Did you know that every 6 minutes, an elderly person suffers a stroke that could have been prevented? This is not just a cold statistic. Behind that number are real lives: a grandmother who will never tell stories to her grandchildren again, a father who will no longer walk in the backyard, an entire life interrupted in a matter of minutes. And the most alarming part is that, in many of these cases, the tragedy is linked to the improper use of common medications, drugs that might be in your home right now, sitting in the bathroom cabinet. And before we continue, if this type of content alerts you and helps you take better care of your health and the health of those you love, click like and subscribe to the channel now. This way, you help this information reach more people and make sure you don't miss out on any important content that could literally save lives. A recent study revealed that the improper use of just 4 classes of medication can significantly increase the risk of stroke. One of them, in fact, is used by millions of people every day as if it were harmless, and it's precisely the one that worries me the most. What I'm about to show you may radically change the way you manage your brain health, especially if you're over 60 or care for someone in that age group. First of all, it's crucial to understand what actually happens in the brain during a stroke. Imagine your brain as a city. The streets are arteries, and the houses are neurons, which need oxygen and nutrients to function. When a stroke occurs, traffic on one of those streets suddenly stops. This can happen in 2 main ways. The first and most common is an ischemic stroke. It occurs when a clot blocks an artery and stops blood flow. The cells in that region stop receiving oxygen and begin to die within minutes. The second type is a hemorrhagic stroke, where an artery ruptures, flooding brain tissue with blood and causing destructive compression. Both types are extremely serious, and the risk increases as we age, especially for people with high blood pressure, uncontrolled diabetes, or those who use certain medications improperly over long periods. And those are exactly the ones we're going to talk about now. Let's start with non-steroidal anti-inflammatory drugs, known as NSAIDs. This class includes popular medications like ibuprofen, diclofenac, and naproxen. They're used for common pains, back pain, joint pain, headaches, and are available over the counter. For that reason, many people take them frequently and with dangerous confidence. But what few people know is that for those over 60, these medications take on a new profile. They stop being allies and become a real risk. And this happens due to several physiological reasons. The first is the increase in blood pressure. These drugs cause the body to retain sodium and water, which increases the volume of circulating blood. At the same time, they make arteries stiffer. The result: more fluid, moving with more force, through narrower and harder vessels. That's a recipe for hypertension, the #1 risk factor for stroke. The second way these medications affect the body is even more subtle. They can damage the kidneys, especially those already weakened by age or other conditions. They also promote the formation of clots in undesirable places, like the brain's arteries. And what makes this situation even worse is lifestyle. People who consume ultra-processed foods, high in sodium, and drink little water create the perfect scenario for chronic inflammation of the arterial walls. Imagine sandpaper continuously rubbing the inside of your blood vessels. This ongoing irritation facilitates cholesterol buildup and plaque formation. And eventually, those plaques can break loose and block a brain artery. Faced with this, the question becomes, what can you do? The answer is not to live in pain or to stop taking your medications on your own. That can be even more dangerous. The solution begins with an honest conversation with your doctor. Ask clearly and firmly, "Doctor, is this medication really necessary in my case? Is there a minimum effective dose? For how long should I take it?" There are alternatives. Acetaminophen, for example, is usually safer for the heart and kidneys in cases of mild to moderate pain. There are also creams and gels with topical anti-inflammatories that act directly at the pain site without affecting the rest of the body. And of course, complementary therapies make a big difference. Physical therapy, acupuncture, stretching, and light exercise help strengthen muscles, improve mobility, and relieve pain without overloading the body with medication. Turmeric, for instance, is a powerful natural anti-inflammatory. It can be taken in capsule form or added to food, always with medical guidance, especially if you're already using other medications. Another natural option is the topical use of aloe vera gel, which provides direct relief for joint and muscle pain. We're not talking about miracles, but smart choices that, when combined, lead to results. The key isn't excess or absence of medication. It's the balance between relief and protection. In the next part, we'll talk about another widely used medication for a common condition, one that may be silently eroding the brain health of millions of older adults. Few people realize that a simple pill to control the bladder can silently affect the brain and increase the risk of a stroke. But that is exactly what's happening to millions of people who take medications to treat urinary incontinence or what's known as overactive bladder. The fear of involuntary urine leakage changes many people's daily lives. They stop going out, exercising, or even laughing freely. To manage it, they turn to anticholinergic drugs, medications like oxybutynin or tolterodine. These drugs work by relaxing the bladder muscles, helping prevent leakage. Seemingly harmless, they are prescribed frequently, especially to older adults. However, there's one detail that is rarely mentioned. They interfere with a key substance that keeps the brain working properly: acetylcholine. This substance acts like a natural lubricant that keeps neurons functioning in harmony. It's essential not only for muscle contraction in the bladder, but also for memory, concentration, and reasoning. By blocking acetylcholine in the body, these medications don't act only where they're supposed to. They circulate throughout the entire body, reach the brain, and may cause mental slowing, confusion, memory lapses, difficulty concentrating, and even excessive daytime sleepiness. Many people think they're simply getting forgetful with age, but in reality, it's the daily pill slowly silencing their brain. And there's more. These drugs can also affect the blood flow to the brain. The arteries become less flexible and lose their ability to dilate properly when the brain needs more oxygen. Even slight impairments in blood flow increase the risk of brain lesions. As if that weren't enough, these medications can also cause drops in blood pressure, dizziness when standing, and a higher risk of falls, which can be catastrophic in older adults. In light of all this, the first step is to find out whether the medication you or a loved one is taking belongs to the anticholinergic group. It's not difficult. Just look up the name of the active ingredient and check which class it belongs to. If you're unsure, ask your doctor directly. Be clear: "Doctor, could this medication be affecting my memory? Is there a safer alternative?" The good news is that alternatives do exist. One of them is mirabegron, a more modern medication from the beta-3 agonist class. It works differently and doesn't interfere with acetylcholine, which means it poses far less risk to the brain. But behavioral changes can also make a big difference. Kegel exercises, for instance, help strengthen the pelvic floor muscles and restore bladder control. They're easy to learn. Just contract and relax the same muscles you use to stop the flow of urine. When practiced daily, the results can be remarkable. Another effective strategy is bladder training. This involves urinating on a fixed schedule, even when you don't feel the urge, to retrain your urinary reflex. Over time, the body adapts, and the urgency and leakage episodes decrease. Additionally, it's essential to watch what you're putting into your body. Beverages with caffeine, soft drinks, alcohol, and very acidic foods can irritate the bladder and worsen symptoms. Simply reducing these from your diet can bring noticeable improvement. So, the message is clear: treating urinary incontinence is necessary, but it shouldn't come at the cost of your brain health. The right medication should treat one part of the body without harming another. Balance comes from conscious choices, asking the right questions, and seeking options that respect all stages of life. In the next few minutes, you'll understand why another widely used class of medication, corticosteroids, can also pose serious risks when used for long periods. And what's most concerning is that many people have no idea about the silent damage accumulating in their vessels and arteries. Among the medications that pose serious risks when misused, oral corticosteroids occupy a critical position. Substances like prednisone and dexamethasone are frequently prescribed for respiratory crises, severe inflammation, autoimmune diseases, and allergic reactions. And they do work. They reduce inflammation, relieve pain, and provide rapid symptom relief. But this immediate relief can come at a high cost to the body if the use is prolonged and not closely monitored. Corticosteroids affect various systems in the body simultaneously, and because of this, their side effects are wide-ranging and often devastating when ignored. One of the first impacts is a rise in blood pressure. These drugs cause the body to retain large amounts of sodium and water while simultaneously leading to the loss of potassium, a mineral essential for maintaining healthy blood pressure and muscle function. This imbalance puts extra strain on the heart and adds pressure to the arterial walls, creating the perfect environment for a stroke. The second major concern is the rise in blood glucose. Corticosteroids directly interfere with insulin action, triggering blood sugar spikes even in people who have never been diabetic. This condition, known as medication-induced diabetes, accelerates the aging of the arteries, making them stiff, fragile, and more prone to rupture or blockage. The third issue is their impact on cholesterol levels. Corticosteroids tend to raise LDL cholesterol, the so-called bad cholesterol, and increase blood viscosity. The result is slower circulation, thicker blood, and a greater tendency to form clots, a dangerous combination for the brain, especially when other risk factors are already present. And even if the doctor has prescribed these medications for a legitimate reason, it is essential that they be used with intelligence and caution. The question that must be asked is simple but powerful. Doctor, am I taking the lowest effective dose? Is there another way to treat my condition without relying so much on corticosteroids? For many conditions, such as asthma, chronic bronchitis, and autoimmune diseases, there are less aggressive alternatives. For instance, instead of oral corticosteroids, the use of inhaled or topical corticosteroids can offer localized benefits without affecting the entire body. In inflammatory joint diseases, there are immunomodulatory medications that allow for a gradual reduction in corticosteroid dependence. Additionally, integrating natural strategies can help strengthen the body and keep symptoms under control. Turmeric, previously mentioned, continues to be an excellent ally. Rich in curcumin, it has a deeply anti-inflammatory effect supported by consistent scientific evidence. It can be consumed as a powder in food or in standardized capsules, always under professional guidance. Another valuable resource is green propolis extract, known for its immune-modulating and anti-inflammatory properties. It can be taken in drop form, mixed with water or natural juices, always respecting the recommended dosages. Now, if corticosteroid use is truly unavoidable, it becomes even more important to have a parallel protection plan. This includes regularly monitoring blood pressure, glucose levels, cholesterol, and, of course, maintaining a balanced diet. Minimizing salt intake, cutting out ultra-processed foods, controlling refined sugar consumption, and adopting daily physical activity are essential pillars to protect the brain even during a more aggressive treatment. What matters most is understanding that every decision has an impact. The medication that brings relief today cannot come at the expense of your most precious asset, brain health. Good medicine is that which cares for the entire body, balancing benefits with risks, and respecting the unique needs of each individual. In many cases, the damage isn't immediate. It accumulates silently until the body finally sends a warning sign. And by then, it may be too late. That's why every decision must be made responsibly, based on reliable information and in open dialogue with professionals who are truly committed to your health. Among all the medications mentioned so far, there is one group that deserves maximum attention: antipsychotics. Originally developed to treat severe psychiatric disorders such as schizophrenia, these drugs, including risperidone, olanzapine, and quetiapine, have been increasingly used, especially among the elderly. And this has raised growing concern among health experts. When used correctly, these medications can be extremely helpful in specific cases. However, what has become common is their use outside of those indications. For instance, elderly individuals with dementia are often medicated with antipsychotics to control agitation, insomnia, or aggressive behavior. In some cases, they're even prescribed to people who simply have trouble sleeping, without first exploring safer, less risky alternatives. This seemingly easy solution hides a very dangerous reality. Major health regulatory agencies around the world have issued their most severe warnings about the use of these drugs in elderly patients. That's because studies show that the risk of death nearly doubles when antipsychotics are used in older adults with dementia. Even more concerning, the risk of stroke may triple. But why does this happen? The first issue lies in their effect on blood pressure. These medications can cause sudden drops in pressure when someone stands up, a condition known as orthostatic hypotension. This not only increases the risk of falls and fractures but can also lead to episodes where the brain receives too little blood, resulting in silent damage that accumulates over time. The second risk is linked to heart rhythm. Antipsychotics can cause arrhythmias, irregular heartbeats that encourage clot formation. And those clots, once in the bloodstream, can travel to the brain and cause a stroke. The third factor is their metabolic impact. These medications significantly alter metabolism. They raise blood sugar, increase cholesterol levels, promote weight gain, and can even induce diabetes within a matter of weeks. And as if that weren't enough, recent studies show that they also make the blood thicker and more sticky, further increasing the risk of vessel blockages. It's an extremely concerning scenario, especially because these decisions are often made without considering safer alternatives. When an elderly person starts showing agitation or confusion, the response should not be an immediate prescription. First, you must investigate. Is the person in pain? Do they have a urinary tract infection? Are they hungry, thirsty, cold, scared, or just disoriented due to a change in their environment? Creating a welcoming space, speaking patiently, playing familiar music, simplifying daily tasks, and respecting individual rhythms are actions that take time and dedication. But in many cases, they can replace the need for strong medications. If an antipsychotic has been prescribed for someone in your family, ask questions. Firmly inquire, "Doctor, is this really the only option? Have we tried all non-drug approaches? Is there a plan to stop this medication as soon as possible?" These medications should always be a last resort, and even then, only for a limited time. They should never be used to control behaviors simply because it's more convenient or faster. The apparent calm they provide may come at too high a cost. With accurate information and professional support, it's possible to find strategies that preserve the dignity, well-being, and brain health of our loved ones. This is not about rejecting medicine, but about using every tool at the right time, with wisdom and responsibility. In light of everything discussed so far, one truth demands urgent attention. The indiscriminate use of common medications is contributing to a silent epidemic of strokes among the elderly. And the most alarming part is that in many of these cases, the risk could have been avoided with a different choice, an honest conversation, or a simple review of the prescription. This is not about demonizing medications. Every substance has its value when properly indicated, in the right dose, and for the appropriate duration. The problem arises when what should be the exception becomes routine, or when a medication is used to suppress symptoms without understanding the real cause behind them. And that is exactly what's been happening to millions of people. Painkillers taken daily as if they were candy. Bladder pills used without awareness of their impact on the brain. Corticosteroids prescribed too easily and maintained indefinitely. Antipsychotics used as shortcuts to silence the behavior of people who often just needed care, patience, and someone to listen. This reality needs to change. And change begins with information. Knowing what you're taking, understanding how it works in your body, and what the real risks are, this is a basic right. Demanding transparency and clear explanations from the professional guiding your treatment is not disrespect, it's an act of self-care. In this context, the role of the doctor becomes even more important. A good professional doesn't just hand out a prescription. They listen, guide, weigh options, and seek solutions that respect the whole person, their body, their mind, and their life story. And that includes responsibly evaluating whether the prescribed medication is truly the best path, or if there are safer, more effective alternatives for that particular issue. If you are caring for an elderly person, or if you are already over 60, it's worth reviewing all the medications currently in use. Check whether any of them belong to the drug classes we've discussed. Talk to Dr. Miguel Lacerda or the trusted health professional who oversees the case. Ask clearly, is this medication safe for my age and health condition? Are there alternatives that may carry fewer risks? Modern medicine offers more and more options. There are natural resources with anti-inflammatory properties and protective effects on the nervous system. There are physical therapies, movement practices, functional nutrition, and techniques that strengthen the body without causing harm. Technology is on our side, but it will only be useful if used wisely. And that wisdom begins with the awareness that no choice is neutral. Every decision, whether it's a pill taken, a checkup postponed, or a symptom brushed aside, has consequences. Brain health, in particular, demands constant vigilance. The brain doesn't always send out loud warnings. When it suffers, The signs are often subtle, slow, progressive, until one day, everything changes in an instant. That's why prevention is always more effective than cure. And in this case, prevention means thinking before taking, asking before accepting, searching before giving up. Above all, it means caring with intention for the body you'll live in until your very last day. If this message resonated with you, leave a comment below. Share this content with someone who needs it. And if you haven't done so yet, click subscribe now to keep receiving videos with information that truly makes a difference for your health and for those you love. Your support is essential to help more people access this kind of guidance. Remember, knowledge doesn't just save lives, it gives them more quality, more dignity, and more time with the people who matter most.